Thank you so much. My name is Ole Tastrup, and I'm the CEO and co-founder of 2Curex. With me, I have Martin van der Linden, who is our Chief Business Officer. So Martin will make sure that we earn money at some point. Let me just go through what we will tell you over the next 20 minutes. We'll start with some breaking news that we actually released here a couple of days ago. Work over what is 2Curex. Those of you that do not know that, we will give you a short description on what we are about and our main product being IndiTreat. Then we will lay out for you the commercial roadmap for us to get this product launched. But to the breaking news. 2 days ago, we announced that we have received CE IVD marking for our main product, IndiTreat. This is a major undertaking for 2Curex. Very important for our process forward. Go to the market. It is, as we say there, sort of a trade passport to the European market. But almost as important, it has sort of firmed up our internal processes. It has really commercialized and professionalized the company. So what would the effect of this be? Well, the effect will be that we now can go into a commercial situation. This product is aimed at the colorectal cancer market. In Europe, we have around 500,000 people that are diagnosed with colorectal cancer every year. About half of them, 260,000, are offered medical treatment. These 260,000 are in essence eligible for the IndiTreat testing. So in rough numbers, that gives a market size of about 8 billion. But let me, as I said, just mention for those of you that do not know 2Curex what we are, who we are. I don't know, this probably can't be seen. 2Curex has actually been around for quite a while. We are a spin-out from Carlsberg Research Center way back in 2006, and we listed at First North in Stockholm in November of last year. IndiTreat, being our main product, is a matchmaker between patient and the right treatment. And we have developed this IndiTreat and tested it in more than 1,000 patients. We are running 2 types of clinical trials at the moment. In colorectal cancer that I mentioned, but we have also gone into another major cancer, namely ovarian cancer. We have a strong financial position. We had a successful IPO there in November of last year, and we topped that with 30 million Swedish from the EU. And last but not least, we have now received the CE IVD marking. Here's a movie explaining what IndiTreat is all about. Can you put some sound on, please?
Parts of the body. But in reality, there are actually more than 100 different types of cancers, and there are more than 400 different drugs and drug combinations available. This makes the task of choosing the right cancer treatment very challenging, and that challenge is reflected in the response rate among patients being treated, which today is around 30%. Often, the oncologist only has one shot at choosing the right treatment, and it usually takes months before they can see any results. This is where IndiTreat can assist. IndiTreat is a method that focuses on finding the perfect treatment for every individual patient. A small sample is taken from the patient tumor. IndiTreat then expands this sample to hundreds of microtumors and tests all available treatments individually. In a matter of days, IndiTreat identifies the effective treatments from the ineffective ones. This is done by measuring the growth of the individual microtumors. An effective treatment will kill the tumor cells, which causes the microtumor to shrink. IndiTreat then presents detailed data on every treatment tested. This helps the oncologist to choose an effective treatment for every individual patient. IndiTreat will increase the number of cancer patients responding to treatment. 2Curex. Because cancer patients are individuals.
This was a very graphical explanation of what we are about here. We present it a little bit differently. What you see is actually in the first panel, we take the tissue. We need a small tissue sample. In this example, it is tissue that has been taken from the liver. This is a patient that is in late stage metastatic disease. The colon tumor have spread to the liver. We take a small needle biopsy, and from that we create thousands of small microtumors that have the same properties as the tumor in the patient. We have loads of data to support that. And then we simply test whether a specific treatment, and there could be hundreds of them, will inhibit the growth. You will see in the top panel here to the right that that treatment doesn't work. You can see that the tumor in those 4 panels simply grow independent of the treatment. So there we have a patient that is resistant. The patient should not be treated with that. On the other hand, on the lower panel, you see an effective treatment. And maybe we can get the music turned off. The effective treatment shows that not only is the growth inhibited, the tumor actually completely disintegrate. That is the kind of treatment that we then offer the patient. I would like to compare this with something that you all know, namely, how do we find the right antibiotic for infectious diseases? Since the 1940s, we have actually tested, as you will see in that lower panel there, how a few drugs will affect and kill the bugs. In this case, the lower one, that's the treatment that you go for. In essence, we do the same for cancer, what these tests have done for infectious diseases. There's a lot of academic scientific support for this being the way in which you should design treatment in the future. And very importantly, we have protected it. So the last patent was actually issued just a couple of months ago that does cover the whole process. This is how these microtumors look like. And the only thing you should see there is that it is highly heterogeneous. So our microtumors are composed of all the different cells and components that the original tumor has. And how does a screen look like? What you see here is a screen where we have going down these PT numbers, that's patients, and going over at top is different treatments. Green is good, red is bad. And what you should see here, there's not a single drug or treatment that works in all patients. So we are very different with regard to drug responses. That's where IndiTreat comes in. And we are set in 2 major cancers. Colorectal cancer is actually the second most common cancer for women, and the third for men. They have an average age of around 70. And if we go to the lower one, the ovarian cancer that we were out mentioning here in mid-spring, it's also called the silent killer. Unfortunately, these patients, we see them very late in the disease. Actually, 75% of the patients have progressed to the metastatic state when we see them. The women are younger and they are doing worse with regard to survival. So 2 devastating cancer diseases that IndiTreat is now being tested in. And how does that actually work in real life? Here's an example of a patient, stage 4 colorectal cancer patient. We get the patient in and then we test the patient. And what you will see, unfortunately, is all red. So these are standard treatments. There are none of these treatments that works in this patient. What we then do is we add what we call off-label. So we add drugs that are used for other types of cancers. They are approved, so they are on the market, but they could be for other types of cancers, or we combine them in a way that haven't been done before. In this case, we were lucky to find that TAS-102, being a combination of 2 drugs, actually worked in that patient. That's the treatment the patient will be offered. And who are doing it? We have clinical partners in Denmark, where we have 3 hospitals now, Bispebjerg Hospital, Rigshospitalet, and Vejle. Then we have a major hospital in Hamburg, University Clinic Eppendorf, Hamburg, and we have one in Birmingham, the UK, Queen Elizabeth Hospital. All of them are major hospitals in the cancer arena, and we are adding more hospitals. We have a number of discussions ongoing. Very important for us is that we will be present in all our markets. And the Europa colon that I'm just have a bubble there out to the right, left for you guys. That is the biggest patient organization within colorectal cancer in Europe. Very important is we see patients pushing for this. I'm being called now very, very often of patients that say, I've heard of this stuff. How do I get in? How do I get treated, or my mom or granddad? The clinical trials are progressing as planned, and we actually have had press releases out here just before the summer, and I'll just point to the one top right, that is Rigshospitalet in Copenhagen. They come out with their own press release saying that they are really engaged, and they find that is for the ovarian cancer project. We have a management team. We have actually an international management team, a couple of Danes, Dutch, and a German. And that's been very important for us because I said we are in all the markets. Okay, we can't have one for every market, but nevertheless, our board of directors have a lot of skills and experiences in medtech, drug discovery, and finances. And now I would give you the mic.
Yes, thank you, Ole. Well, it's a pleasure also to be here to take you a little bit more on the road where we are going. And the first slide I want to show you is basically the question to you is why to invest in 2Curex. And we believe that 2Curex is really interesting because it actually takes a step into treatment from personalized medicine to individualized treatment. And we think that is a very interesting approach. There is luckily lots of new drugs developed, and you will hear fantastic stories about that today as well. But we would like to take your focus on IndiTreat, where what Ole just said before is this matchmaking between existing drugs and the patient, individualizing this treatment. This is on the short term can give us substantial financial gain. We will launch the product in 2020, and what we call this is a low risk investment, with solid gain for you as an investor. And how are we going to do that? Yes. So a couple of things to keep in mind. There is actually a very big unmet medical need here. 70% of the cancer treatments today fail for the patient. So it's really important that a technology like IndiTreat will come to the market to give the opportunity to individualize treatment to make that success rate much higher. IndiTreat can be called a matchmaker, as we said sometimes earlier as well. But another big number is this 260, in the excess of 260,000 patients annually that are eligible for an IndiTreat test. Also important to remember our IP. We are going to bring a technology to the market where we've done our utmost to protect this as much as possible, and also already now achieved our passport to the European markets, our CE IVD label, which is an incredible success factor for launching in the coming time. We are very well connected in the hospitals. We actually have an office inside a hospital, so we are close to the market, as you could say. But also our German office, our daughter company, is located at a very important hospital in Hamburg called Eppendorf, and you just saw a picture of that. And we have a solid cash position with a successful IPO late last year in 2017, and also a solid backing from the EU project Horizon 2020. So all of this actually leads us into a timeline or a roadmap for where we are going, and we are on track for success. In 2017, we met the milestone of bringing the company to the market, and then you can see here in the green boxes are all the things we said at the IPO and communicated in the prospectus that we would deliver. And the latest one, of course, the CE IVD label, the registration of the product, and we want to expand to other oncology centers beyond the oncology centers that we already have now in our markets, the Nordic countries, Germany, and the UK. So that brings us to 2019, and here we will, of course, put focus on delivering on our clinical trials, also prepare for launch readiness in our markets, and last but not least, we also are working on ISO certification of our organization that also will help us in our commercialization. And then 2020 launch of IndiTreat. So to close off here, so the vision is very clearly establish IndiTreat as a global standard for individualized treatment, and to make sure that people respond to their drug therapies. So thank you so much for your attention. That was the last slide.
Tack så mycket. Har vi någon i församlingen som vill passa på att ställa någon fråga? Ja, ett ögonblick så kommer en mikrofon.
Hi, you have an X in your name. What is your plan to, because if I understand it right, it's actually your ability to learn from patient reactions to the drugs. That is actually the critical knowledge that you have. So what is your plan to do the same for other cancer treatments?
We started with colorectal cancer, and generally we are in solid cancers. So we are now in ovarian as well. We have shown that it works in a number of other solid cancers. So we do not believe that there are, or now I need to be a little bit cautious, but I think it will be applicable to most solid cancers. It's just a major undertaking when you go into a new entity, because you need to have the clinical support. You need to we need our CE, IVD to include a new cancer. So there's a lot more than just the technical development. Technically, we do not see a major issue. And as said, we have already tried it in a number of other solid cancers where it works. So you will see from us in the coming period that we will go into other types of solid cancers.
Okej. Tack för det svaret. Fler frågor? You mentioned that you've gotten a grant from EU. What sort of things do you have to present in order to release the money? Because I take for granted that everything has not been released in once. It comes in different portions. Is that correct?
Yes, it's an amazing grant. I've had 4 or 5 EU grants that I've coordinated. This is by far the best. There are no co-financing. So 100% of what we spent will be reimbursed by the EU. We have received 50% upfront. So we received 15 million Swedish in March. And the only beneficiary, so the only partner that received funds, that is 2Curex AS in Copenhagen and 2Curex GmbH in Hamburg. We have actually what we forwarded to EU was pretty much our standard business plan. So it was the same we sent to EU that we actually made a prospectus around. So it is just we need to execute on our business plan provided to the market. Then EU will also be happy.
Okay, thank you. Yes, we have a question, please.
For me, it would be interesting to hear if you would like to compare yourself and your work with other company, Oncology Ventures. Mm-hmm. You're into the same field, as I understand.
Yeah, now Oncology Ventures is here today, so maybe they should answer themselves. But what I can say is that when a patient comes into a hospital setting, they will be tested in a number of different ways. They will all be scanned. They all go through pathology. We will take biochemistry from blood samples, and then they will get a genomic profile, as for instance some of what Oncology Ventures are doing and others. What they lack is a functional test like ours. So we don't see ourselves as competitors to genomic profiling. We see IndiTreat as the missing piece of the puzzle. Because, I mean, none of these technologies will send scannings out of the door. Every patient is being scanned. So the oncologists just need a huge panel of tests and technologies to be able to give the right treatment suggestion. And so we actually see IndiTreat as just being part of the package, to be part of the standard guidelines to be done on every one of these patients.
Tack
so
för
supplementing.
Det. Tack för det svaret. Har vi någon ytterligare fråga? You mentioned Germany as one of the centers where that you're using in order to carry out your work. Would it be fair to say that we could see other sites being part of your operations, for example, the UK, or would we see a site in the US testing your ideas?
Well, with the US, you're going a little too fast, I think, as you could see with the potential in Europe. This is where we start. Yes, a facility in Germany, a facility in Copenhagen that can service Denmark and potentially also Sweden. But UK is definitely also on the board for us to do the same thing as we are doing already in Germany. So to answer your question, yes, we are looking at different markets in a certain sequence where we are looking at on different models on setting up the testing facility, the testing of IndiTreat in those markets.
Okay, thank you. Questions? Anything you would like to add? Anything really edgy for the company that differs you from and makes you really stand out?
I actually think that the slide that Martin presented, namely that you can attack individualized treatment in two ways, new drugs or IndiTreat, and both of them are valid. IndiTreat have a different risk profile, so I think for an investor that would be diversifying, that you take IndiTreat in as a lower risk, and we say solid gain already from 2020. If you are in drugs, as we will see today, there is a tremendous opportunity for a gain, but there is likewise a risk. So we have a different risk profile.
Thank you. Thank you very much.